My name is Chuck Cooper. I'm Chief Medical Officer for BMRU. I'm a practicing infectious disease physician. Antimicrobial resistance, often referred to as AMR, is essentially the ability of bacteria to resist the effects of antibiotic therapy. So what happens is when patients are treated with an antibiotic, if there is AMR or antimicrobial resistance, then the antibiotic won't actually be effective. It's a silent pandemic because people don't really realize the extent of the problem. It is truly a significant global public health issue, and people are not aware of how big of an issue it is. In fact, a recent review showed that AMR, antimicrobial resistance, was directly responsible for 1.3 million deaths around the world in 2022, and up to 5 million deaths were actually related in some way to antimicrobial resistance. There are projections that this number is going to increase significantly over the coming decades. So it truly is a global public health crisis. In fact, currently, there are projections that the annual deaths directly related to antimicrobial resistance will reach as much as 10 million deaths by the year 2050. So diagnostic testing is critically important in the fight against antimicrobial resistance for a few reasons. It has to do with the challenges with actually treating patients who are suffering from a severe infection. If you overtreat them unnecessarily, you actually have the chance to actually worsen antimicrobial resistance. On the other hand, if you undertreat them, the patient is more likely to suffer a severe outcome as a result of undertreated infection. So diagnostics are critically important to ensure that physicians are able to effectively treat severe infections to the best degree possible, so that patients are not either unnecessarily overtreated or inadvertently undertreated.